Hi, everyone. Let's see. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Wednesday, August 18th. I'm here to give you the update of what's going on or what happened yesterday in our county with regard to COVID-19 transmission. It's not pretty. The cumulative number of cases is 58,317. 598 cases were added yesterday. 99 people were admitted to the hospital yesterday with COVID-19, bringing the cumulative number of people hospitalized with COVID to 7,207. Yesterday, the number of people in the hospital with COVID-19 went up again to 486. Again, that is a record number of people in area hospitals. Yesterday, 33 deaths were reported. They didn't all occur in the last 24 hours. Some of them
July 27th.
Went back to July 27th. Thank you, Mark. So the 33 deaths reported yesterday, some of them had died previously and we just learned about them, but most of them did occur in the last couple of days or weeks. That brings the total number of people who died to 945. So again, we're seeing the highest number of cases and hospitalizations and deaths in unvaccinated people. Anywhere from 90 to 96% of these cases and hospitalizations and deaths are occurring in people who are unvaccinated. If you are unvaccinated, the only way you can protect yourself from COVID transmission, from getting COVID, is to wear a mask, keep your distance from people that don't live in the same household as you do, stay at home if you're sick, quarantine if you've been exposed. So those are your only protections if you've not been vaccinated. And for all of us, because vaccination takes some time to help us build protection, the only way to immediately interrupt transmission is to mask up and stay 6 feet away from anyone that you don't know. So it's super important that we all start implementing those measures as soon as possible so that we can somehow get to, a peak of this current wave, this record-breaking wave that we are seeing, and start slowing transmission so that we can, get back to something like we had in June. It's going to take a really long time before we get there. But please implement protection measures because, 486 people in the hospital, 33 people who've died, these numbers are just astronomical. And it's just, it's really sad for our community because we know that masking and distancing and staying at home when we're sick and washing our hands and covering our cough and getting vaccinated works to prevent transmission. We know what works. We just have to have the will to implement the prevention measures to slow the spread of COVID-19. We still are hearing a lot of confusion from parents and daycare owners and school nurses and school superintendents about when a child or an adult should be excluded from a school setting. So the Alabama Department of Public Health have come out with a new one-pager. The font is really small, which is the only way they could get it on one page, but we're going to be socializing this and trying to help people understand that children who have COVID, teachers or workers who have COVID should be excluded, should go home. And sort of it also describes exclusions for close contacts of COVID patients. It talks about schools notifying parents when there's been a COVID positive child in the classroom or in the group or in the cohort. Talks about exclusion from school and also includes child care facilities. We've been getting a lot of questions about, do the K through 12 recommendations apply to daycares, and there is some guidance in this new handout of when to exclude people from school or childcare facilities, and then when there can be some exceptions to exclusion. So again, we'll be sending this out widely, sharing it on social media, trying to get it in the hands of all of the superintendents, all of the school nurses. Hopefully the superintendents will send it to all of the parents so that you can have this as a guidance document for what you should do if your child has COVID or is exposed to someone with COVID. All right. I think that's all the updates I wanted to give today. Remember, we're still doing walk-in testing and vaccination at 2 locations at Mobile County Health Department. One is at our downtown Keeler location, our main location at 251 North Bayou Street, and that is Monday through Friday, 9 to 3:30. And the other location is at our Newbern Health Center on 248 Cox Street. So at the Newbern Center on Cox Street, we're there Monday through Friday, 9 to 7, and on Saturday we'll be there 10 to 6, and Sunday 12 to 4, trying to provide those extended hours for people who work Monday through Friday during the day. So please be patient. These locations are quite small. We cannot accommodate the volume of people who want to get tested. When we were at the mall, we had plenty of space, so we could test 400, 500, 600 people a day. But at these locations, we really can only accommodate about 200 people a day, and sometimes the waits are long. But I saw a sign in the at a drive-through a couple of days ago. I went through to get a glass of tea from my favorite sort of donut place, and the sign in the window said, "The whole world is short-staffed. Please be kind to those who showed up." So please be kind to our staff that are coming to work in some extraordinary circumstances to provide free testing and free vaccination to our community. We have staff outages just like many other locations, so we're really thin right now with resources. So please be kind to the people who showed up to do the good work of public health by offering prevention measures to protect you from illness, injury, and death. All right, here are some questions. There's been a lot of talk about increasing capacity for monoclonal antibody treatment. We have been talking to hospitals. The city's been talking to hospitals. USA has been talking to the city and to hospitals. The state health department has been talking to people locally, and so there is a lot of discussion about trying to expand services for either IV or subcutaneous administration of monoclonal antibodies that can help keep people out of the hospital as an outpatient treatment. So yes, a lot of conversations going on in parallel to figure out how we might be able to increase the availability of monoclonal antibody treatment for those who might most greatly benefit from it. People who would be predisposed to severe illness, treating them in an outpatient way to help them prevent hospitalizations. Because right now, our hospitals are full, we have no beds, emergency departments are full, there are no ambulances available. So, our system is tapped out. We're it's as bad as it has been. Funeral homes are overcrowded. Hospitals are overcrowded beyond capacity. So please just do whatever you can do to try to slow transmission of COVID. So someone, a news outlet saying, "We hear there are no ambulances available in Mobile. Can I talk about how bad that is?" I mean, a lot of people rely on emergency medical services for things that happen that you have no control over. You have an accident, you have a heart attack, something unplanned happens, and you need urgent transport to the hospital so that you can get the very best care in the emergency department. When there are no ambulances, people, would have to take their own vehicles to the emergency department. They're still going to have to wait, but they won't get those life-saving treatments between the location of their injury or health event and at the hospital. So it could really mean that people have bad outcomes where, for really something that could be totally avoided if we as a community would work together to stop COVID transmission. So it will be very sad when, a mother goes into labor, or someone has a heart attack, or a motor vehicle accident injured, a person or a child that needs transport to the hospital, and not having an ambulance available to that, just to do that, is just really an extremely unfortunate situation. And we all have contributed to that very dire situation by not doing what we should do to keep our community safe. All right, let's see if there are other media questions before I get to the Facebook questions. Let's see. So someone's asking me a question about hospital preparation, and the hospitals prepare all the time. They don't just wait until there's an emergency, a hurricane, a tornado, an infectious disease outbreak. They are in preparation mode all the time. And what they went through last year shows their resiliency, their competency, their ability to surge, to increase and decrease services when available, when needed. And I think they're also doing that now. They are showing that despite extraordinarily record levels of COVID infections and hospitalizations, they are doing the best that they can do with what they have. And I think that is admirable and shows the level of preparedness and practicing and drilling and dealing with emergencies every day, every week, every month, every year to do that. What's preventing them from controlling it are the people in Mobile County who are not doing what they need to do to slow transmission. So it's not the hospital's fault that too many people are getting COVID, right? It's our community. It's us. We know what we need to do to slow the spread. So, if you can, pull out your mask, wash it, put it on so that we can help our hospitals. See what else. This one just came into a rumor that Mobile has no more cold storage space for the deceased. We had been contacted by just one funeral home that said they had a large number of decedents that they were working through, but they did not say that they had run out of space. And we, sorry, there's something, a bug or something flying around. Leaning forward into getting refrigerated trucks or ordering more body bags. I mean, this is a preparedness effort, right? It doesn't necessarily mean that our morgues are full. So if you hear a rumor about, there's a refrigeration truck that showed up at the hospital, I mean, that's a wise move, right? You need to kind of prepare for things before it happens. It is no joke that we have seen the most deaths reported to us in one day, right? It is happening. It is as bad as it has been. So I don't think anyone should be surprised that our hospitals and funeral homes are having to prepare for how bad it could get. And that's just them doing what they should be doing. All right, let's see, Facebook questions. Someone had the Johnson & Johnson vaccine but haven't heard about how protective it is against the Delta variant, if they need another dose, those sorts of things. So as far as we know, the Johnson & Johnson vaccine does protect against the Delta variant. Again, the J&J vaccine is slightly less effective at preventing hospitalizations and deaths than Moderna or Pfizer, but not much. I'm talking about like tenths of a percentage point or something like that. And it has advantages because you are fully vaccinated, considered fully vaccinated just 2 weeks after you get your shot. So you're protected much sooner than if you got Moderna or Pfizer. And you're right, there have been no mentions of a third dose or a booster dose for the Johnson & Johnson vaccine. So we'll probably hear more about that in months to come. Someone got the J&J vaccine, should they get a booster with Moderna or Pfizer? The answer to that right now is there is no recommendation to switch products. So if you got J&J, CDC, no one is recommending that you go out and start another series of Pfizer or Moderna. Someone saying, is it that 2 shots don't provide enough antibodies, or it just wears off? So in these people who are moderately to severely immunocompromised, 2 shots of their body just doesn't make antibodies as well as a healthy person. And so that's what's happening, is that the 2 shots is not getting their level of immunity up to where it needs to be. So we want to give them a 3rd dose to try to boost their antibody response up to where a healthy person might be with just 2 doses. Can those with asthma who take treatments daily get a booster? So remember, right now the 3rd shot is a dose. So if you fall into that moderately or severely immunocompromised, and I read those yesterday, I don't have them today, I don't think, but talk to your doctor. If you are moderately or severely immunocompromised, then get a 3rd dose of Moderna or Pfizer. All right. This is a rather lengthy bullet, so I might have to parse this one out a little bit and make sure I can. So someone asking about hospitals and other healthcare providers testing. When are they going to start prescribing treatment options as soon as someone tests positive? So there's really just, outpatient therapy using the monoclonal antibodies. And so if you are one of the people who would benefit from getting that, then a prescriber can, refer you out for that. I think right now part of the difficulty is the demand is exceeding the resource that we have. And if you have to wait, the monoclonal antibody treatments should be initiated very close to symptom onset or to test positive. After 10 days, you probably will not benefit from a monoclonal antibody treatment. And because we have so few locations and prescriptions of the monoclonal antibodies, it sometimes is taking, several days, maybe 10 to 14 days to get an appointment. And by then it's really no longer a benefit to people. So there are a lot of things at play here. We need to increase the availability of outpatient monoclonal antibody treatment for sure. And everybody is working towards that end. And other than that, remdesivir, monoclonal antibody treatment, and convalescent plasma treatment, those are the only FDA authorized treatments for COVID, right? So when you ask me about treatment, I'm not thinking vitamin D or, taking these over-the-counter meds. Like I think of treatment as being an FDA authorized treatment. So there are only a few of those. See, please report the % vaccinated deaths and hospitalization. So 96% of deaths are unvaccinated. That means that only 4% of people who died have been vaccinated. For hospitalizations, about 90% of hospitalizations are unvaccinated. So about 10% of people who are hospitalized are vaccinated, and those people have underlying medical conditions that would predispose them to very severe outcomes or immunocompromise, which might make their vaccine not protect them as much as a healthy person would. Someone asking about not being able to give plasma or infusion after vaccination. I don't know. So I think maybe some things are getting mixed up here. So we tell people if they get an infusion or plasma treatment, if they get monoclonal antibodies or plasma treatment, we want them to wait 90 days before getting vaccinated, right? Because that, those things help boost your immune response, and we don't know if they're what your body might do if you then get a vaccine and you're kind of working double time. So the recommendation is that you wait 90 days after an infusion or a plasma treatment before you get vaccinated. But to my knowledge, there's no reason to defer treatment if you are fully vaccinated and then get COVID, right? Then you could still get treatment. There's no need to wait. Here's a question. Can you get your second dose of vaccine if you received an infusion? You need to wait, right? So if you got vaccinated, then you get a treatment, then you need to wait before you get your second dose. Someone asking about quarantine requirements for fully vaccinated families. So if your entire family is fully vaccinated and someone still gets COVID, that person has to stay at home for 10 days. Everyone else in the family needs to wear a mask when they leave the house, and they should get tested probably every 3 to 5 days through 14 days. So they don't have to stay at home, but we will ask them to wear a mask when they go outside, and it would be best if they get tested every 3 to 5 days through the 14 days that they would normally quarantine. But they're exempt from staying at home because they've been fully vaccinated. Now, why 3 to 5 days? So we want people who get vaccinated are likely to have mild illness if they do get COVID. So they may be infectious to others and not recognize it because they don't feel bad. And so that's why we want you to get tested every 3 to 5 days until 14 days. So someone asking about age groups. So, yeah, there are lots of different ways to slice age groups, and it sort of depends on the disease. So like for COVID-like illness, when we started looking at age groups, we used the age groups that have been used for influenza-like illness for 30 years. So, 0 to 4, 5 to 7, 18 to 24, 25 to 49. Those are the age groups that have been used for influenza, because it's like, baby to toddler, pre-K, early elementary, then college age, that sort of thing. There are other diseases where you do look at it like 0 to 9, 10 to 19, 20 to 29. It really depends on sort of historically, what is the biology around the illness? Is it more likely to occur in children or older people? So it's sort of like just sometimes personal preference, but usually there is some historical reason why they were split up the way they did. What we are starting to do, I think we did it on today's daily. Yeah. So in today's daily report, if you notice, we've actually changed the way that we're grouping ages to be 0 to 4. So people who, kids that aren't in pre-K, 5 to 11, and then 12 to 17. The state changed their numbers so that we could look at things a little bit more granular in those younger age groups. So you probably noticed that change today. So someone asking if there's a model to predict when Mobile County might be on the downward slope of this wave. There is. It looks like the downward slope will probably take us well into October. Where are the antiviral stations for treatment of diagnosis of COVID? So mostly it's hospitals giving remdesivir, monoclonal antibody treatment, or convalescent plasma at hospitals. All right, I think that's it. So we will stop here for today, and got a lot of work to do. We had a statewide call just before coming in. That's why I was a little bit late. First statewide call for the Alabama Department of Public Health that we've had in a while, and things are bad all over the state. We're hoping in Alabama we may be seeing a slight reduction in the number of cases, but of course, because of the lag in hospitalizations and deaths, we're not even close to peaking with those two measures. So again, guys, I'm just asking for your help. I know we're all tired. I get it. We want to act like, this year is going to be different. But here we are, and we know what we need to do. We just got to do it. So take care, everyone. Be safe, and we'll talk again tomorrow.